my name is Peyton Brewster, and I will be discussing antipsychotic-induced gastrointestinal disorders. This is the element of what I'll be discussing today. I'll be introducing antipsychotics, discussing gastrointestinal disorders associated with them, and I'll be giving two examples of antipsychotics, their mechanisms, and how they relate to gastrointestinal disorders, and I'll be discussing the integration of gastrointestinal risk into antipsychotic selection. Antipsychotic medications are drugs that are primarily used to treat psychosis-related conditions and symptoms, but they can be prescribed for other non-psychotic conditions as well. There are two main types of antipsychotics, typical and atypical agents. Atypical agents were first developed to address the limitations associated with typical agents, such as lack of efficacy, lack of improvement in negative symptoms, and movement-related side effects. They primarily block dopamine D2 receptors in the limbic system, the area of the brain associated with emotions and behavior, unlike typical agents which block D2 receptors throughout the brain, including the basal ganglia, which is associated with movement. Atypical agents also block serotonin and 5-HT2 receptors more strongly relative to dopamine D2 receptors, which helps improve negative symptoms. Antipsychotics are widely used for many different conditions, however, they can cause significant gastrointestinal side effects. A retrospective study that looked at hospitalized patients being treated with antipsychotics over a period of 22 months found that 36.3% of patients, which is 99 in this case, received at least once a pharmacological treatment for constipation. Severe cases which were non-responsive to initial treatment got x-rays done of their abdomen, and 68.4% were found to have fecal impaction. The first example I'll be discussing today is clozapine, an atypical antipsychotic which is highly effective for treatment-resistant schizophrenia. This medication, however, is shown to cause serious gastrointestinal complications. Studies show that 300 to 600 per 1,000 patients treated with clozapine experience constipation. Serious complications such as ileus, bowel obstruction, ischemia, and necrosis occur in at least 4 per 1,000 patients, and approximately 1 in 1,000 patients may die from severe gastrointestinal side effects. In a specific study measuring colonic transit times in psychiatric inpatients, it was found that the patients on clozapine had a median transit time of 104.5 hours, which was more than 4 times longer than the typical 23 hours. Before I get into the mechanisms of clozapine, I want to discuss the picture on the right. This picture is from the study that measured colonic transit times, and you can see the difference. The x-ray on the left is patients that were not on clozapine, and the x-ray on the right is patients that were on clozapine. So back to mechanisms with clozapine. Clozapine has high serotonergic activity, more so than many other antipsychotics, and it also blocks D2 dopamine receptors. Blocking both the 5-HT2 and the D2 dopamine receptors may contribute to the gastrointestinal issues associated with clozapine, because both serotonin and dopamine regulate gut motility and nutrients absorption. Interfering with these pathways can slow transit, causing constipation and other gastrointestinal complications. The second example I'll be discussing today is olanzapine, another atypical antipsychotic that is associated with gastrointestinal issues such as constipation. In a study of rats treated with olanzapine for up to 30 days, they found that the rats given the medication developed constipation by day 70, which persisted through day 30. The study also found that when testing the colon smooth muscle contractibility ex vivo, which is outside the body, the contractile response was significantly reduced in olanzapine-treated rats when stimulated with serotonin or acetylcholine, which are agents that normally cause contraction. As for the mechanisms of olanzapine, like clozapine, blocks dopamine D2 receptors and serotonin 5-HT2 receptors. However, the strength of these blockades is weaker than clozapine's. The gastrointestinal issues associated with olanzapine, such as the reduced smooth muscle contraction and constipation found in the rat study, likely primarily results from the blocking of the action of acetylcholine activity rather than the blockades of dopamine or serotonin receptors. So you may be asking why this is important and why gastrointestinal risk matters in antipsychotic selection. Gastrointestinal side effects are important to know because they can impact adherence to antipsychotic treatments. Making awareness of these risks are essential when choosing a medication. Understanding gastrointestinal risk helps both patients and healthcare professionals make more informed decisions about antipsychotic selection. And the knowledge of these risks allow for early recognition of gastrointestinal issues and for prompt interventions, potentially preventing serious complications. As for the summary and key takeaways of this presentation, antipsychotics, drugs used to treat a variety of conditions, are heavily associated with gastrointestinal issues ranging from mild constipation to life-threatening conditions. Clozapine and olanzapine are two antipsychotics that have been found to have gastrointestinal side effects, likely due to their impact on the dopamine, serotonin, and acetylcholine pathways that regulate gut motility. Knowing the gastrointestinal risk associated with antipsychotics is important in medication selection and early intervention. And these two slides are my references slides. Thank you.